In the summer of 1878, a cattle town in southern Kansas recorded 14 deaths in 6 weeks. Not from gunfights, not from outlaws. 12 of the 14 died from contaminated water. The town's only well sat 40 feet from its main outhouse, and when the rains came that July, whatever was in the ground moved sideways. Nobody made the connection until the second week of bodies. Welcome to Mystery Wild West. And what you're about to hear is not the version most people know. If this is the kind of history that actually tells you something real, the kind that explains why things happened the way they did, subscribe. We go deeper here than most. Before we go any further, here's a question that deserves a real answer. When you picture a cowboy riding into town after 2 months on the trail, what do you imagine? Dust on the boots, maybe. A weathered hat. But do you imagine the smell? Do you imagine what 2 months without a bath, in the same clothes, in the same saddle, in 100-degree heat, actually produces? Because that is where the real story of the Wild West begins. Not in a gunfight, in a wash tub that nobody used often enough. The myth of the frontier is a myth of action. Fast draws and long rides and brave men making split-second decisions under pressure. The reality was slower and quieter and more disgusting than any of that, and it killed far more people than any gunfight ever did. The biggest threat to life on the American frontier wasn't violence. It was biology, invisible, patient, and everywhere. Start with water. A homesteader in Nebraska in 1872 drives a well by hand, using a hand-bored auger dropped 20 or 30 feet into the earth. The water he finds is cold and clear and tastes clean. He builds his outhouse nearby because the outhouse needs to be close to the house, especially in winter, and because nobody has explained to him, and the science to explain it doesn't yet exist in practical form, that what goes into the ground from the outhouse will, in time, travel toward whatever water source is nearest. The distance that seemed like enough wasn't. The soil that seemed like a barrier wasn't. And the well that looked clean was slowly becoming something else. That process took months or years. The family drank from it the entire time. Dysentery, typhoid, cholera in the right conditions. These diseases moved through contaminated water with a precision and efficiency that no weapon of the era could match. A family that got sick didn't necessarily connect it to the water, because the water looked the same as it always had. It tasted the same. It came from the same depth. The idea that something invisible and deadly could live in clear cold water was not part of most frontier families' understanding of how illness worked, so they kept drinking, and some of them kept dying, and the ones who survived developed a partial immunity to certain strains, or were lucky, or lived in places where the geology slowed the contamination enough that the dose they got was survivable. And the ones who weren't lucky are in the cemetery records, listed under causes like summer sickness or intestinal fever. And this is where things change, because water was only the beginning. Think about what a cattle drive actually smelled like. Several thousand animals moving together across open land for weeks at a stretch. The men driving them slept on the ground, cooked over open fires, and had no access to bathing facilities of any kind. Creeks and rivers were crossed when the drive crossed them, and a man might wade through one and consider that adequate for the week. The clothes they wore were the clothes they had. Changing shirts was a luxury that required carrying a spare, and most trail hands traveled with the minimum that could be tied behind a saddle. A trail hand who had been out for 60 days smelled in a way that no modern person has experienced and no Hollywood film has attempted to reproduce. Not just sweat, though the physical labor in summer heat produced that constantly. The combination of sweat, animal proximity, wood smoke, trail dust, dried blood from the cattle, and the specific biology of clothing worn without washing. For weeks created something that contemporaries occasionally tried to describe in letters and journals. The words they used were usually practical. Nobody is going home yet. The drive continues. Smell was simply a condition of the work, not a complaint worth making. But the smell was a symptom. The conditions that produced the smell also produced something else. Lice, body lice specifically, were endemic across frontier populations to a degree that is almost impossible to fully communicate. They lived in clothing, in hair, in bedding. In a bunkhouse where multiple men slept close together in fixed bunks, lice moved freely between hosts. In a frontier family's sod house, where everyone slept in the same room and often in the same bed for warmth, lice were simply part of the household inventory. This wasn't because people didn't know about them or didn't try to address them. It was because the conditions made sustained control nearly impossible. The clothing had to be boiled to kill lice eggs, and boiling laundry required large quantities of hot water and significant fuel, both of which were scarce. The bedding had to be treated. The hair had to be treated, usually with kerosene or a similar substance that was effective but harsh. And then, if any one person in the household or bunkhouse had escaped treatment, the cycle started again within days. A man in a mining camp in Colorado in 1875 described in a letter the process of delousing that the camp undertook after a particularly bad infestation. Every man's clothing was boiled, bedding was burned, hair was cut short and treated. The process took 2 days and disrupted the entire operation of the mine. He described it not as an emergency, but as a periodic necessity, something that had to be done every few months. Every few months. That's the reality. But here's the problem. Lice were uncomfortable. They were embarrassing. They were exhausting to manage. But they weren't the most dangerous thing living in the conditions of frontier hygiene. The most dangerous thing was what happened when the skin broke. A scratch, a blister from a boot, a cut from a tool or a wire or a piece of metal. A wound that, in a modern setting with soap and water and basic antiseptic care, would heal without incident in a week. On the frontier, any break in the skin was an entry point. And the environment of the frontier was saturated with bacteria in ways that no amount of willpower or toughness could overcome. Blood poisoning. That's what the frontier called what medicine now calls sepsis, an infection that started small, a finger, a hand, a leg, and spread through the blood when the body's defenses couldn't contain it. The progression was specific. Redness extending outward from the wound, following the veins, swelling, then fever, then, if it wasn't stopped, a failure of systems that nothing in a frontier medicine cabinet could reverse. And the frontier medicine cabinet was not equipped for this. A miner in Nevada in 1869 cuts his hand on the metal edge of an ore cart. It's a clean enough cut, not deep, and he wraps it with what's available, a piece of cloth that has been used for other purposes and isn't clean in any meaningful sense. He goes back to work. In 3 days, the hand is swollen and red lines are moving up toward the wrist. In 5 days, he has a fever. In 8 days, he is dead. That sequence happened constantly across the frontier. Not occasionally. Constantly. In the documentary records, the diaries, the newspapers, the letters, this kind of death appears over and over in language that treats it as a known risk of life rather than a preventable tragedy. Because it was a known risk. People knew that cuts could go wrong. They didn't know exactly why or how to reliably prevent it. The germ theory of disease, the understanding that specific microorganisms caused specific infections, wasn't established in medical practice until the 1870s and 1880s, and its adoption by frontier practitioners lagged behind that considerably. In the absence of that understanding, frontier medicine did what it could. Whiskey was applied to wounds, with some genuine antiseptic effect, though not enough. Poultices of various kinds were used. Amputation was performed when the infection had reached a limb and hadn't yet reached the body, removing the infected tissue before it could spread. Frontier surgeons amputated arms and legs with a frequency that is startling to consider, specifically because amputation was often the only intervention available once infection had taken hold. The survival rate after amputation was itself uncertain. The surgery was performed in conditions that were not sterile by practitioners who understood cleanliness in broad terms, but not in the specific sense that would have made a real difference, with tools that were cleaned between uses, but not in ways that eliminated bacterial contamination. A man who survived a frontier amputation had beaten significant odds, twice, once when the infection started, and once on the operating table. Think about what this meant for everyday decisions. A cowboy who got a bad blister from his boot during a long drive knew it could go wrong. He didn't always know what to do about it. He kept riding because the drive didn't stop. He kept the boot on because taking it off might make remounting difficult. He watched the blister and hoped it stayed clean. Sometimes it did, sometimes it didn't. A farmer who drove a nail through his hand while building a fence made the same calculation. Wrap it. Keep working. Watch it. Hope. And this is where things get harder to look at, because the risk wasn't distributed evenly. Women who gave birth on the frontier in conditions that had no concept of sterile technique faced an infection risk that was among the highest of any group on the frontier. Childbed fever, puerperal sepsis, was the result of bacterial infection introduced during or after birth in a context where the hands attending the birth, the instruments used, and the environment itself were not clean in any medical sense. It was common, devastatingly common. Women who survived multiple pregnancies sometimes attributed it to luck because they had known women who hadn't survived, and the difference often came down to factors nobody could control. A doctor, traveling a frontier circuit in Kansas in 1876, recorded in his notes that of the 12 births he had attended in the previous year, 2 mothers had died within a week of delivery. He noted it alongside the weather records and the number of miles traveled, 16%. And he was a trained practitioner doing the best he knew how to do with the understanding available to him at the time. The women giving birth without any trained practitioner present faced worse odds, and many of them did. A circuit doctor covered hundreds of miles of territory and couldn't always arrive in time. The neighbor who served as midwife knew what she had learned from experience and from other women who had learned the same way, through observation and trial and error, without the scientific framework that would have changed the outcomes. Now here's a question worth sitting with. If you had grown up on the frontier and watched people die from what appeared to be small wounds, from drinking water that looked perfectly clean, from giving birth in the normal way, what would you have believed was killing them? What explanation would have made sense to you in the absence of germ theory, in the absence of microscopes, in the absence of any way to see what was actually happening? Most people on the frontier explained these deaths in terms available to them. Bad air, miasma, the will of God, weakness in the individual, bad luck. These explanations weren't ignorance in the sense of stupidity. They were the best frameworks available for processing events that had no visible cause. But they led to no practical interventions. You couldn't improve bad air by washing your hands. You couldn't improve miasma by boiling the water. So the deaths continued. The outhouse situation deserves more attention than it usually gets because it was a contributing factor to disease in ways that extended beyond just water contamination. In a cattle town or a mining camp with a growing population and minimal infrastructure, outhouses were built close together and close to everything else because space was not the priority. Proximity to where people lived and worked was the priority. In a mining camp that had grown from a few tents to several hundred men in a matter of months, the sanitation infrastructure, if it could be called that, had not kept pace with the population. A visitor to a booming silver camp in Nevada in 1873 described the smell from some distance before arriving. The combination of several hundred men, multiple outhouses in varying states of maintenance, animal pens, refuse piles, and the general output of a working camp in summer heat produced something that hit you before you could see the camp. He described it matter-of-factly as part of his account of conditions, not as a criticism, as a fact. Flies were part of this ecosystem in a way that mattered directly to health, though the mechanism wasn't understood. Flies moved between the outhouses and the food preparation areas with complete freedom, carrying bacteria from one to the other. A cook who kept a relatively clean kitchen was still operating in an environment where flies from the nearest outhouse visited his work surfaces dozens of times an hour. The contamination was invisible and constant. Dysentery spread through this pathway regularly. It presents as severe intestinal illness, cramping, fever, the body losing fluids faster than it can replace them. In a setting with clean water and basic medical care, most healthy adults survive it. In a setting where the water used to rehydrate is itself contaminated and medical care is days away, dysentery killed people. It killed children disproportionately because small bodies dehydrate faster. The wooden crosses in frontier cemeteries, the small ones clustered near the larger ones, tell that particular story without words. And this is where things change in a way that reframes the entire mythology. The frontier was presented, in the stories that got told afterward, as a place where the strong survived and the weak didn't, where character determined outcome, where a man with enough courage and capability could shape his own fate. That framing served a narrative purpose. It made the frontier into a story about human will. But the actual determinant of survival on the frontier, more than courage, more than skill, more than any quality of character, was the invisible biology of the environment. A man could be the best shot in the territory, the hardest worker, the most capable horseman who ever lived, and still die from drinking the wrong water. A woman could be the most competent homesteader in the county and die from a bacterial infection 10 days after a perfectly normal birth. The disease didn't evaluate your character. It didn't care what you deserved. The bathing situation was complex in ways the mythology flattens completely. The image of a cowboy riding into town and heading straight to the barber for a hot bath has some truth in it. Bathing facilities existed in frontier towns, and men who could afford them sometimes used them. But access was uneven, cost was real, and for families on isolated homesteads, the bathing equation was different. A family sod-house bath meant heating water on the stove in significant quantities, filling a tub that was usually a large barrel or a galvanized metal basin, and bathing in sequence. The water was shared. The smallest child first, usually, while the water was cleanest and hottest. Then each successive member of the family in some order, until the last person bathed in water that had been through everyone else. Then the water was disposed of, a process that itself required effort. This happened weekly if the family was organized and had enough fuel to heat sufficient water. More commonly, it happened less often. In winter, when water had to be hauled and heated and the house was cold, bathing became something that happened when absolutely necessary and not before. Undergarments were worn for weeks at a stretch. This is documented in frontier accounts with a matter-of-factness that indicates it wasn't considered remarkable. The same shirt, the same long underwear, through multiple days of physical labor. The fabric absorbed the work. The smell was part of the environment. Cowboys on a drive had a specific logic about it. Changing clothes meant having clean clothes to change into, which meant carrying them, which meant weight and bulk that the trail didn't accommodate. Some trail hands had one extra shirt. Some had none. The clothes on their backs were the clothes they had, from the start of the drive to the end. A trail cook was sometimes the only person on the drive who had reliable access to hot water and fire. Some cooks used this as informal leverage. The men who helped with camp duties, who were useful and cooperative, occasionally got a chance to wash something. The men who didn't. The hierarchy of cleanliness on a cattle drive ran through the cook's tent and nowhere else. But here's the problem with the entire picture. The people living through it didn't experience it the way we would if we were suddenly dropped into it. They had grown up in conditions that were, by modern standards, also quite poor in terms of hygiene. The baseline was different. The threshold of what seemed clean, what seemed acceptably dirty, what was remarkable versus what was routine, those thresholds were set by the world they had grown up in. A man who had grown up in a rural Eastern household in the 1840s and 1850s, bathing infrequently, sharing water, living close to animals, eating food prepared in kitchens that had none of what we would now call food safety, that man, arriving on the frontier, was moving from one set of conditions to a somewhat worse set, not from a clean world into a dirty one, from a moderately compromised world into a more severely compromised one. That gradation matters because it explains why so much of what strikes modern readers as obviously dangerous wasn't experienced as obviously dangerous by the people living through it. The water in the well looked the same as it always had. The cut on the hand looked like cuts had always looked. The baby arrived normally. The normal outcomes were survival. And when death came, it often came in a way that connected to nothing visible, which made it feel like fate rather than cause and effect. The absence of the germ theory framework meant that people couldn't take the specific interventions that would have saved lives. But it also meant they weren't living in constant conscious fear of the invisible, which would have been its own kind of psychological burden. They just lived in conditions that killed a significant percentage of them from causes they didn't understand, and they buried the ones who died, and they kept going, because what else was there? Dental hygiene operated on a similar principle of absence. Toothbrushes existed and were used by some people some of the time. Tooth powder existed. But the systematic dental care that prevents cavities and gum disease was not part of frontier life for most people. Cavities progressed to abscesses. Abscesses caused infections that spread. Tooth infections killed people on the frontier. Not commonly enough to be considered a major cause of death, but commonly enough to appear in the documentary record as a recognized danger. A bad tooth was a crisis. There was no dentist in most frontier communities, and when one existed, the treatment was extraction without reliable anesthetic. A frontier dentist's primary tool was removal. He pulled what was causing problems and moved on. The pain of the process was legendary and real, and many people chose to endure a worsening tooth for as long as possible before submitting to the alternative. Some of those people made it through. Some developed an infection that the body couldn't contain, and some of those died from a toothache in the most literal sense, in a way that would be almost impossible today. Here's something that cuts to the center of what the mythology got wrong. The frontier was romanticized in its own time, and that romanticization served a purpose. It made a brutal and often senseless process seem purposeful and noble. Men and women who were dying of dysentery and sepsis and contaminated water, who were killing themselves slowly with the conditions they couldn't escape, were framed as heroic pioneers building a civilization. They were building something. That part was real. But the cost, the physical cost, the biological cost, the cost measured in small graves and fever deaths and infections from scratches, that part was left out of the story being told while they lived it. The dime novels that circulated during the height of the frontier era featured shootouts and chases and confrontations of will. Nobody wrote a dime novel about dysentery. Nobody wrote one about the infection that started in a blister and ended in an amputation. Those stories didn't sell because they didn't fit the shape of the myth being constructed. And so, what was actually killing people most efficiently across the frontier, the water, the wounds, the births, the teeth, the invisible biology of crowded conditions and minimal sanitation, got edited out of the story before the story was even finished being lived. The grave markers are still there. Drive through rural Kansas or Nebraska or Colorado, and you'll find pioneer cemeteries on rises above the flatland, some with markers worn past reading, some with small stones that indicate a child rather than an adult. The records attached to those graves, where they survive in county courthouses or historical society archives, tell the real story: summer sickness, intestinal fever, blood poisoning, childbed fever. The cause listed as unknown, and the age listed as 14 months. Those records are the part of the story the myth left out. Not because the people who built the myth were dishonest about everything, because the myth needed heroes, and heroes don't die of bad water. Heroes don't die of infected blisters. Heroes die the way the myth requires them to die, in confrontations, with their choices mattering, with their character determining the outcome. The truth is harder than that, and quieter, and more final. Here is a last question worth carrying with you. The next time you see a Western film, when the cowboy rides into a town after weeks on the trail and walks into the saloon looking like a man who has merely had a long day, think about what's missing from that frame. Think about what the camera doesn't show and what the story doesn't tell. Because in that gap between the myth and the reality, between the clean version and the documented version, that's where most people on the frontier were actually living. Not in the gunfight, in the well water, in the wrapped cut that went wrong by Thursday, in the winter that came early and the fuel that ran short and the fever that followed. The frontier was a real place. The people who lived and died there were real. What they died of was real. And it was almost never what the story said it was. The saloons were a study in frontier hygiene logic. The floor was dirt or rough-cut wood, swept occasionally, coated over time, with mud, tobacco spit, and everything the boots of a cattle town brought in from outside. The spittoons were there. Many men didn't bother. The bartender wiped the same glasses with the same cloth all night, rinsed in a bucket that started dirty and ended worse. The drink itself, whiskey, often home distilled or cut with whatever was available, was sometimes the cleanest thing consumed in the building. Alcohol killed bacteria. Not reliably, not in all concentrations. But the frontier understood that whiskey was medicine in a broader sense. Men added it to stream water. Wounds were washed with it when available. The instinct wasn't entirely wrong. The problem was that the whiskey was consumed from contaminated glasses, in a building with a dirt floor, in a town where the main water source was doing something nobody had understood yet. The environment usually won. Food preparation on the frontier operated under similar constraints. A chuck wagon cook on a cattle drive was working with whatever he had: dried beans, salt pork, flour, coffee, in conditions that made anything resembling modern food safety impossible. Flies on the food, dust in everything, water from whatever source the drive had most recently crossed. The cook managed these conditions as best he could, which meant keeping things covered when possible, cooking at high heat, and working fast enough that food didn't sit long before being eaten. High heat was the frontier's most reliable defense against foodborne illness. Boiling water, fully cooking meat, baking bread through these practices, understood without the scientific framework to explain why they worked, reduced risk in ways that were meaningful. A cook who simmered the beans long enough was killing bacteria he had no name for. He just knew that undercooked food made people sick because he had seen it, and making people sick on a cattle drive was a professional failure he didn't want repeated. But even with careful cooking, the conditions reasserted themselves. Leftover food from the evening meal, stored until morning in the summer heat of a Texas plain, was a different proposition by breakfast. A man who ate yesterday's beans that had spent the night in a warm Dutch oven was taking a risk that varied by temperature, by the original contamination level, by how long the beans had actually cooked. Sometimes he was fine, sometimes he wasn't. The medical practitioner who served frontier communities was working at the edge of what medicine could do. By the 1870s, some doctors had access to the emerging understanding of antiseptic surgery, the use of carbolic acid solutions to clean instruments and wounds before and during surgery. This approach, developed in Europe and spreading slowly through American medical practice, could make a significant difference in surgical outcomes. But a frontier doctor might have read about it without having the supplies to implement it, or might not have read about it at all, depending on how current his training was and how isolated his practice. The gap between what the best medicine of the era knew and what the frontier practitioner could actually do was often significant. A trained surgeon in a city hospital in the late 1870s was operating in a different world than a circuit doctor covering 3 counties on horseback with a bag of instruments, a limited drug supply, and patients he saw once a year if they didn't die in between visits. That circuit doctor did real good. Frontier communities needed him, and he showed up. But there was a ceiling on what he could accomplish that no amount of dedication could raise. The ceiling was set by what medicine knew and what conditions allowed. Both of those were limited in ways that cost lives every season. The children who survived frontier conditions developed something through exposure. Surviving the water, the lice, the contaminated environments of childhood provided some immunity to some conditions, but it required surviving the exposure to acquire it. The ones who didn't survive acquired nothing except a place in the records. A county in Kansas that kept careful records from its settlement period in the 1870s shows infant mortality rates that, by modern standards, represent a catastrophe. By frontier standards, they were normal. That's what the baseline was. The mythology required a different baseline, a frontier where people were tough and survived because they were tough, where the land selected for the capable and rejected the weak. The truth was that the land selected for the immune and the lucky, and there was nothing about being tough that protected you from what you couldn't see in the water. A man could be tougher than anyone else in the territory and still be dead by August from what he drank in May. That's the part of the story that got left out every time, because it didn't fit the shape of what people wanted the frontier to be. And so the myth grew clean, and the reality stayed dirty, and the distance between them widened with every retelling until we arrived at a place where people could watch a man ride into a frontier town and never once wonder what the water was like. Now you know. And that changes what the West was. Not less impressive, not less real, just honest. The people who built it were doing so in conditions that modern medicine would recognize as a serious public health crisis, managed by people who didn't have the tools to know what they were managing. They built it anyway, through the dysentery and the lice and the infections and the fever and the small graves and all the rest of it. That's what the frontier actually was. Not clean, not simple, not the version that made it onto television, but real and human, and harder than any story gave it credit for being.